Hi there, this is Dr. Perry, and this is part one of a series of video tutorials to show you how the Gamma System Analysis Suite works. So the first part really is just to show you the information resources that are available for you to help inform and guide your testing. So as soon as you log on to your Gamma System Analysis Suite, this is the menu that will greet you. Now if we hover over this body here, we see an interactive body which we can click on, and depending on which area we want to test. So if we start with the neck or the cervical area, click on that. It gives you some information about what the cervical area does in terms of its function and its extensors, its flexors, its lateral flexors and rotators, etc., etc. So we click on extensors, for example. It then gives you a breakdown of all the different muscles, all the way from deep to superficial, and what their innervation is. If you want to test the muscles, it shows you the testing positions and in relation to the X and Y axis. So, for example, if you work with motorsport athletes, Formula One athletes, then this is perhaps something you want to pay close attention to. If you perhaps want to look at their extensors and their lateral flexors, given the fact they have to deal with front and side G. So that's the cervical area. So let's move on to shoulder. And again, we've got a breakdown of what the shoulder does, its range of movement, and all the various movements that occur within the shoulder. So extensors, flexors, abductors, adductors, external, internal rotation, and scapular retraction. So let's say we wanted to have a look at the flexors of the shoulder. Click on flexors, and then it gives us a nice little breakdown of all the muscles, their primary and secondary function, and also their innervation, and how to test them using the GS Analyzer. Move on to elbow. Again, same thing. Explanation of what the elbow does, its anatomy, and the movements that are achieved in the elbow. So that's extension and flexion. So if you want to test the extensors, click on extensors. It gives us a nice little nice little picture diagram of how we do that. Okay, let's move on to hands and wrists. So yes, we can test the hands, we can test the wrists, we can even test the fingers as well, including the little finger. Let's have a look. So little finger abductors. Again, what muscles are we testing? What their innervation is, how to do it. Thoracolumbar. Again, nice little description of what the thoracolumbar spine does, what it's comprised of, its anatomy, how it works, and the movement, so extension and flexion. So how do we test extension? Again, got all the muscles that are involved, all the way from deep to superficial, what their innervation is, and the various testing positions. So back extension with left rotation and right rotation. Let's move on to hip and pelvis. So again, we've got all the movements, extension, flexion, abduction, adduction, internal and external rotation. Let's have a look at abduction. Got all the muscles all the way from deep to superficial, their innervation, and again, the various different testing positions and how you do it. So let's move on to knee. So we've got, again, a nice little description of the anatomy, physiology, how it works. We've got extensors and flexors. So if you work with footballers, for example, this is something you might want to pay close attention to. You might want to examine what their hamstring quadricep ratio is in terms of ACL prevention, hamstring injuries, etc. And this is something that is very achievable using the GS analysis, the analyzer and the analysis suite. So again, we've got a nice little breakdown of all the muscles, all the nerves that are involved, and how exactly you test it. Very detailed and some very useful diagrams here. We go all the way down to the foot and ankle. Again, we've got all the movements. So in ankle, dorsiflexion, plantarflexion, inverters, everters, and the great. And we can even do the great toe. So let's look at great toe extension. We've obviously got the muscles here: extensor hallucis longus, extensor hallucis brevis, and what their innervation is. And then we've got how do we test it. So it's actually a great learning tool as well. And so this is the sort of introduction to the analysis suite. This just shows you what it can do, essentially, and how you test it. In part 2, we'll actually look at how you begin the testing. Thank you.